Hello guys, I'm Nico, as you may well know, and I will be showing a little video on oral rehydration solutions. So, when would you use oral rehydration solutions? You could use them when, anytime really someone is so severely volume down that it will pose a threat to life and limb. So that can include a terrible gash injury that results in a lot of blood loss, which results in being volume down to the point where you might not be cardiovascularly stable. That's one example. Another example could be a severe diarrheal illness that someone can't recover from, like 5 days into a backpacking trip or something like that. And to go on, they need to drastically increase their fluid load. That could be another example, but it's hard to just stick to one specific indication for oral rehydration solutions. Regarding the evidence behind oral rehydration solutions, specifically homemade oral rehydration solutions, since there's so many recipes, there's no one unified study that has proven for sure that homemade or better said, there is no one study that has shown that one specific recipe is superior to other oral rehydration solutions. There's a whole bunch out there, and really the whole crux of the issue is just getting the salt and fluids back in you. So, although there's no definitive one homemade solution that has been proven to be better than the rest in the literature, anything with some salt and water and some sugar will be sufficient as long as you do it in the right proportions. And we're going to talk about the right proportions now. So, the general gist of it is you can start, hopefully, if you have anything with you when you're on these trips, some Gatorade or Tropicana, apple juice or Gatorade. You could use other juices, but these are just some of the recipes that I looked up. So I guess the kind of a drawback with oral rehydration solutions is you kind of have to have stuff with you. You got to have something to mix it with, so hopefully you have a pot or pan, really a pot would be more helpful, or any kind of bowl. Another thing you can do is what we kind of talked about in a few sessions ago on the outdoor session, where you could kind of start a fire on a tree stump and make a receptacle there, and kind of just cup the liquid out afterwards. Not perfect, but if you are low on options and don't have a lot of supplies, don't have a pot, very limited things, then that would be a solution. So this, as I said before, this cannot be made from scratch. You have to have some supplies, which would include some kind of salt. Salt packets, I will tell you, only contain about less than a gram, like half a gram to maybe a little bit less than a full gram. So just keep that in mind when we're discussing the recipe in a few seconds. So, I will show you two examples of how to make the oral rehydration solutions. I don't necessarily want to waste all this liquid because I'm not going to drink all this stuff. I don't need oral rehydration, but I'll just show you the steps, what you can do, and yeah, if you're ever in an emergency situation and you have some supplies, you can definitely use what I'm about to show you. So, the general ratio for the Gatorade is 2 cups of water, 2 cups of Gatorade, and a half tablespoon of salt. But how do you measure that in the wild, right? So for the salt, half a tablespoon. Tablespoon is approximately the width of your thumb. So what you can do, and again, I'm not gonna willy-nilly dump all this salt out because I'm not gonna be drinking this. But pour out in your hand about, a little pile and measure it out in comparison to your thumb. And you want half a width of thumb length and width-wise. Half a length of the thumb and half a width of your thumb of salt. Pour that in your container. Then you get 2 cups. But how do you know 2 cups? So if you have a kind of a small, any kind of small cup. What a cup really looks like is it's 8 ounces. So you think about those little tiny receptacles you get in like dentist office, any waiting room that has the little water containers like this big. So you can approximate it and kind of salt to taste, so to speak. But if you have a little receptacle, or if you have one of these Nalgene's that has these lucky, and some Nalgene's have size markings on them that tell you the ounce measurements, but I will do this one so we can get a sense of how much 8 ounces is in these Nalgene's. A little refresh. So this is about 8 ounces, a little less, so I'm going to probably fill it to like here. So you have one of these Nalgene's, and you want to know what 8 ounces is? It's about to there. So this is not a measured quantity, but like it looks like about 1/10, let's say, of the thing. So that's about 8 ounces if you can't measure it out, and if you don't have a cup measurement, which you probably won't in the wild. Or you can just, again, approximate to taste. But the main thing is you get the ingredients that you need for these things, which is the salt, the sugar, the actual water. So you mix, pour that in there, 2 cups, another cup, 2 cups of water, and then a half a tablespoon of salt. Then you have your mixture. Mix it up. You should be feeding at a rate. Pretty much the way these things work is to the thirst of the patient. And if you have a patient who has, been knocked out or unconscious, impaired consciousness anyway, you should not be attempting oral. You should be doing some kind of IV if possible. If you really need to, you try to wake the patient up as best you can. As in, if you don't have any access to IV supplies, try to wake the patient up as best you can. If you can't do that, you'll have to assess your options and see the pros and cons of trying to give oral rehydration therapy. But really, the contraindications for this would be impaired consciousness, unable to swallow, things like that, and then you would need IV. And we've already discussed the indications. So I will just go over this last recipe, and then I'll let you go. So for the apple juice, it's a little bit of a different ratio. The apple juice has a bit more sugar, so you actually need less of it. Only 1 cup, and we talked about how to measure the cup to approximate it, either in your Nalgene or just eyeball, which you think is, more or less one of those dentist office, any kind of waiting room office, 8-ounce little cups. And then the tablespoon of salt, mixing, and the 3 cups of water instead of 1 cup of water. 2 cups of water, because again, the apple juice has more salt, so you're going to dilute it a little more. So 1 cup apple juice, 3 cups water. That's the general principle with the juices. So Gatorade, you need a little more. 2 cups water, 2 cups Gatorade. Apple juice, you need less. 1 cup apple juice, 3 cups water. And again, half tablespoon of salt. And this half tablespoon, thumb width, thumb length. So that's a full one, so do half. If you're blessed enough to have the tablespoon measurements, do it that way. Again, and the cups too. So, we discussed the indications for oral rehydration therapy, the contraindications for oral rehydration therapy, ways to improvise a vessel, in case you don't have a cut, ways to approximate the measurements, and I hope you will never have to improvise your own oral rehydration therapy. But at the same time, I hope this video gave you the tools you need to make one, and when to and not to use oral rehydration therapy. Thank you so much.